Alright guys, let's talk about patients refusing care from male nurses, whatever you want to call it. Does it happen? Not really. Typically most patients feel bad and they just want to be took care of, and they don't really care, man or woman, who's coming in there to do their treatments. Typically. Now, I give you two instances that I have run into myself of really two different groups that have refused my care or questioned my care. Number one, go with the obvious. The older lady who's been married to the same man for 74 and a half years, and ain't nobody else seen her in nothing more than a gown since she was a baby. Yes, those women can refuse the care from a male nurse. It has happened to me before, and I really just trade off with one of my female counterparts. It typically doesn't happen. Those women that are like that, typically you just kind of got to explain the situation. Hey, you are my patient. I was assigned to take care of you. I am not here to look at you. I am not here to do anything like that with you. I'm going to give you some pills, maybe a shot or 12, and you're going to roll on out this door feeling much better than you did when you got here. And then, I'll explain a little bit better than that, but typically, once you explain the situation to the older females that done been married for 74 and a half years, they sometimes come around. Every now and then, that older woman will refuse the care from a male nurse. I can only really think of maybe 2 or 3 times that it actually went all the way to me having to go get a female nurse. Not very many times. Maybe, like I said, maybe 2 or 3. Typically, no. Also, one thing I've done, I've found to make those women feel more comfortable is grab my CNA. Typically CNAs are female, if you can get you a CNA to come on in there and help you while you're doing your med pass or whatever, and a lot of times if I'm told in the report, hey Chris, this woman may be a little bit, against you coming in as her nurse or whatever it may be. And typically whoever's reporting off to me is good enough to let me know. If that's the case and they report off, hey, this woman may refuse your care, I will definitely come in with the CNA. That way we got 2 sets of eyes on them. And, and that's it. And, like I said, maybe 2 or 3 times I can remember it actually going to the point to where I had to get a female nurse. It's just not very common. It's really not. And the other instance, like I said, I got a couple instances. The other instance, I did pediatrics for a little bit. I'm going to take me a deep breath on this one. So what happens in a young boy's mind, it makes no sense to me. I don't know, I was a younger teenage boy at one point in time, and looking back, I don't know what I was thinking most time when I was that age. But for whatever reason, on the rare occasion that you get some old boy from 13 to about 19, maybe even all the way up to about 20, 21, for whatever reason, whenever you get these patients, they always feel that maybe it's jokes they tell at school, I'm not sure. All nurses are young, pretty women. So when yours truly steps in there, they say, wait a minute, I thought I was getting that pretty girl over there. Nah, bro, they sent me in here. You got me today. And they'll give you a little bit of a fit. I've never had one refuse my care because I was a male nurse, but they definitely give me a little bit of a fit because I was a male nurse. Of course, at that age, you know everything, and if you're like myself, you're a smart aleck. I was definitely a smart aleck. A runny mouth smart aleck. This guy right here, I sure was. And you never know, that patient, if they're feeling good enough, could be a runny mouth teenager. It happens. It's happened to me. Not very much anymore, but it has happened to me. And they'll say, "Oh, what are you doing as a nurse?" You know, or something like that. Or, you know, "You feel real manly in them scrubs." Something like that. You're typically going to get something like that. And like I said, they've never refused my care, but they definitely give you a little bit of a harder time because you are a male nurse. I had one that started out that way, and then towards the end of my care, they were asking questions like, "How do I become a nurse?" Things like that, you know. So they're gonna give you a little bit of a fit. It is what it is. And, you know, not being a female myself, I don't know how the teenage boys do for the females. I will say I have never had a female teenager patient. I've never had one of those. And not because I would refuse them, but I believe that, you know, my charge nurse or whoever was creating the assignments kind of understood, you know, my principles, and that I was going to have the CNA in there at all times. And I think that they kind of understood that. And so I've never had a teenage female patient. So I can't relate to that. They may make smart aleck comments too. I don't really know. But, you know, being a male nurse and the patient load that you get, it shouldn't change. You know, you shouldn't worry about, "Oh, they're going to refuse my care because I'm a man. Oh, they're going to give me a hard time because I'm a man." Anybody has the ability to give you a hard time. I've had harder times from older people than I have from younger people. You know, some people will get physical, and you don't know who will and who won't. Some people will purposely make messes, and you don't know who will and who won't, simply by looking at their age and gender on the piece of paper that you're handed at the beginning of the day. You know, if you've got a frequent flyer, then maybe you know who will and who won't. If you're at a nursing home, you know who will and who won't. But typically, you know, just by that piece of paper and the age and the gender of that individual, you don't know if you're going to have a hard time or if you're going to have a good time. You know, so treat everybody the same. Come into it with an open mind, and typically you're going to have a good night. Like I said, not really anybody refuses your care as a male nurse. Maybe 3 times my entire career. Not very many. So hope it helps. Thank you much.